Hello, my dear people. I welcome you to today's edition of our program and our viewing session. Today, we're going to be talking about inguinal hernia. Remember, hernia has been described before here when we treated hiatal hernia, which occurs here at the junction of the esophagus and the stomach, which happens at the base of the diaphragm here. This time is inguinal hernia. So hernia is often about projection of an organ towards or on a muscle of the abdomen or inside the body and makes it project, makes it bulge, makes it protrude. So, and this is made possible when there is a weakened muscle, when there is a deterioration of that part of the tissue, or when there is something that has caused an opening on that wall. This time in the inguinal hernia, which happens at the pelvic area. Because this part is close to your sexual organ. It could happen to a male or a female, but it's most often in male. And why? Yes, male and female have similar relatives in their sexual organ. Because in males, you have their testicles, scrotum. In women, they have the equivalence of all this, like in the sexual organ of a man, you have uterus that equally is similar to that of the penile organ in a man. Here, that uterus has a connective tissue that goes out, then towards the labia, that goes out to connect to the woman's organ towards the labia where it passes out. The same way, in the scrotum, you have it coming out to the man's penis. So what happens here is that there is a channel that connects that makes it possible for the testicle to descend from the upper part of the abdomen, that's the lower, from the lower part of the abdomen down to where it is based. That happens naturally in every human, and that channel is there. So sometimes that may not close up on time, or it is weakened, and that passage allows the abdominal tissue to equally descend through there and cause a bulge. In female, the connective tissue might display the same thing and cause a problem in the female. So, but more often it happens in male, like I said. So, when that tissue is degenerated equally, when the person is aging, it could equally be another problem. How do this even come to manifest? It comes to manifest when there are certain activities the person will do. So explaining inguinal hernia, it is a hernia that happens in your groin. In a passageway called the inguinal canal, you might see a bulge on one side of the pelvic bone. It's caused by abdominal tissue pushing through an opening in your lower abdominal wall. The opening may be congenital, which is presenting at birth, or due to normal age-related muscle degeneration, as just explained. But I want us to get the picture very, very well. So, the inguinal hernia, how is it caused? What could make it to project that way? A lot of activities. But before we go forward there are two types of inguinal hernia. We have the direct inguinal hernia and the indirect inguinal hernia. The direct inguinal hernia is the hernia that penetrates directly through the wall of your inguinal canal. The type of hernia occurs in adults over time from a combination of weakened abdominal muscles and chronic pressure on the muscle wall. Just like has been explained, even though something happens here in the hiatal. We have other hernias, but we are just taking this gradually, step by step, because there are areas that suffer different kinds of hernias. Let's know what causes and how we can manage it. Indirect inguinal hernia is the one that enters your inguinal canal through the top. This usually occurs because of a birth defect in some fetuses. Fetuses are the children that are in the womb, the baby in the womb. The opening to their canal doesn't close all the way during development of the tissue, so this becomes a problem. Now, let's ask ourselves, get to know more about this. What does inguinal hernia affect? So that has been explained about So your testicle begins above your lower abdomen, descends through the inguinal canal into your scrotum. The place where this testicle passes through is more susceptible. That makes it prone to getting this kind of, makes you vulnerable, because if that is not well closed, depending on individuals. So because that's where it's supposed to descend into your scrotum. As well as in the women, it carries the round ligament that supports their uterus, and this tough ligament helps to reinforce their muscle wall. However, when the connective tissue diseases may be more susceptible with the connective tissue diseases, for those who have diseases on that connective tissues, they are more susceptible to suffer hernias, known as inguinal hernia. But how common is this? It's very common. Inguinal hernia is very common, but it's more, like I said, in male than in females, and it's a very serious one. Like other hernias, this is not something you will start treating with medication. Medication is just to manage pains, but you can only stop it using your activities, ensuring that certain things you do that exacerbate them. And we have to ask ourselves, what and what do we do that causes this exacerbation? Coughing, vomiting, straining, bending. These activities affect those areas that has already been affected or weakened to cause the bump, to cause the lump, to cause the bulge that we're talking about. And what do the person suffer? Pains, different kinds of pains as symptoms. The person suffers pains, the bulge at the groin, feeling of pressure or heaviness, and as well as a burning or pinching sensation. So the causes include opening or weak spots that presents as birth. That's the main cause. The congenital differences, as said, opening or weak spot from previous abdominal surgery. If you had had surgery, this is another thing that could cause it. Then chronic straining to pee or poop. Chronic coughing or sneezing. You know, when you're sneezing, some people hold their sneezing. It's not very good. When you want to sneeze, you're trying to hold it back. Certain things has a lot of impact on your body that is not very healthy. So try and free yourself, but please ensure you cover it. So going forward, years of pregnancy. Remember, obesity again, it's always anything that comes in that way. It equally exemplifies in pregnant, as though if someone is pregnant, like we treated when we did abdominal fat. So obesity, years of pregnancy, and carrying of small children. Normal age-related tissue degeneration. These are the things that can cause you inguinal hernia. And the possible complications, if it's not well treated, if not treated, will be quite severe. Things like incarceration, small bowel obstruction, strangulation, enlargement over time. Now, trying to make this very short and equally, if anything that is not stated here, you'll be able to read it from the article that's always attached to our explanations. And now, if someone has this, the person needs to go for diagnosis, where scans will be done and the person will be found as having hernia. And the next step is, if it has come to the point that you will need to be done surgery. So it is you and the doctor that will consider if it is necessary for you for surgery to be done. Then, if that is the case, then any type of surgery that is recommended or that is available is what will now be used to carry out the surgery on you. There are surgeries like the laparoscopic surgery, there is robotic hernia repair, and the open surgery. So these are the kind of considerations that will be taken, and depending on the individual and how the person can manage or bear anesthesia and the other treatment that's going on, to know the one that is appropriate for the individuals to go on and have a surgery and recover from this particular problem. There are some complications that might happen, like said, and there are some kind of side effects like urinary retention. But what we are focusing on here is how to manage this disease, ensuring that you don't, when you are having it, you don't exacerbate it to bear such bulge that grows so big and people will feel, hey, this person has hernia. Such manifestation exists in areas where information is poor about health, and the person or on that particular person So there is need for anyone who has found out certain symptoms in him or herself to go and see a medical expert, medical doctor specifically, to be able to diagnose, assess him, diagnose, and as well have the appropriate treatment needed. I will stop here, my people, and I'll expect your questions in the comment section for us to treat this topic as much as everybody will understand it. Thank you very much for this day again, and have a great day. Remember, your health is your wealth, and continue to join us on this program, The Health Center with us Young. Thank you.